We've been here for 3 hours straight.
I'm alive, singing amen. I am alive. If everyone cared and nobody cried, if everyone loved and nobody lied, if everyone shared and swallowed their pride, then we see the day when nobody died, and I'm singing amen. I'm alive. Amen.
Hospitals are profit-making institutions. They're not interested in calling in more physicians to pay out more money. I think that's important for us to know. Most of the time, if you were to ask people, why are there tons of people sitting in the waiting room? Most people that are in the waiting room would say, because they're really busy. The staff, the doctors are really busy. Well, that's true, because there's only one doctor on duty. I found this out at a recent experience when my husband was brought to a hospital in an ambulance on a gurney. Brought in on the gurney, and there he sat for 10 hours.
I'm alive. Singing amen. I am alive. If everyone cared and nobody cried, if everyone loved and nobody lied, if everyone shared and swallowed their pride, then we see the day when nobody died.
Well, it's called the emergency room, but perhaps waiting room would be more appropriate. Patients say the ER is becoming more and more crowded these days, and getting admitted to the hospital is taking longer and longer. So why the delays? KCRA 3's Pamela Wu explains.
We're going to go in and see if it needs stitches, and hopefully we won't have to wait that long.
Faith Smith is bringing 17-month-old Riley to the emergency room for a deep cut on his lip. She hopes the wait won't be as long as it was when her husband recently had his appendix taken out.
We had to wait quite a few hours, actually, before he even went back there. And then once he got back there into, like, a room, then it was, like, several more hours.
This is what an average emergency department looks like the majority of the time. An overcrowded waiting room. Patients with...
At about 4 a.m., they said they were going to admit her to the hospital and put her in a room. Well, at 7 a.m., we were still in that cramped cubicle. I complained to the nurse, and she told me that this was a daily occurrence and that they were also understaffed and overworked. I went to another side of the ER and found many people still in the hallway, some new and some from the night before. At this point, I was informed that there was still at least 30 people ahead of us waiting for beds. I beg you to make our emergency rooms a place where we can get help immediately if we are injured or sick. We can't and we shouldn't just stand idly by when emergency room overcrowding and understaffing means that our loved ones are not getting the attention they need in an emergency situation. Lives are being lost due to this serious problem. My story is everyone's story, and yet it shouldn't be anyone's story.
In a systematic manner, the Access to Emergency Medical Services Act provides a rational approach to addressing the crowding or the issues that we see growing in our healthcare system. It creates a commission that examines factors that impede delivery of emergency medical services, including crowding, availability of on-call specialists, and medical liability.
I doubt we can take it a little bit longer.